Executive Director of the Hawaii Health and Harm Reduction Center, and I will be your moderator for this evening. The Hawaii Health and Harm Reduction Center is the result of the merge of the Life Foundation and Child Project, and our mission statement is to reduce harm, promote health, create wellness, and fight stigma in Hawaii and the Pacific. We work at the intersection of the criminal legal system, chronic disease like HIV and hepatitis, mental health, substance use, and houselessness. And if you've never been to our website, hhhrc.org, please consider visiting to learn more about our street-based and in-house services. They're all free. And we particularly try to make sure that no one's left behind. And we have a no wrong door approach, and really appreciate you coming tonight to learn more about monkeypox. So 40 years ago, almost literally 40 years ago, several gay men sat together in Honolulu and developed the plan for what was to be called the Life Foundation, the largest and oldest HIV organization in the Pacific. 4 years ago, as I mentioned, the Life Foundation merged with the Child Project, became H3RC. And as many of you know, we spent the last two and a half years in another public health crisis, COVID. Well, here we are with monkeypox that many of us thought we might get a breather from another crisis. However, we have many lessons learned from both HIV and COVID that really allow us to learn and move forward with education, awareness, vaccination for monkeypox. So this evening, we're going to focus on making sure that you all have the latest evidence-based information on monkeypox. Learn about the Hawaii Department of Health's response, and especially how to access the vaccinations that they have clinics and are partnering with community partners for. And I think one of the most important for many of us is, how do we not repeat the mistakes of the early HIV crisis and even in the COVID epidemic? How do we inform and educate our community without perpetuating stigma? How do we make sure those at risk learn about this, but that we don't, again, make it unsafe for people to be who they are and find out more about this disease? We're really honored this evening to have a collection of experts to share this information and also to help facilitate a talk story at the end so we can hear from you. How do we get the information out to the community so that we can prevent monkeypox, help those that might test positive, but also, again, reduce stigma so that everybody can get information that they need, but we can do that without perpetuating harm. First up, we're going to have Dr. Christina Wang. She is a nurse practitioner and the medical director here at the Hawaii Health and Harm Reduction Center. And she has really focused her efforts in street medicine around wound care and really providing care to people living with HIV, hepatitis, and to people that have other disproportionate harms from communicable diseases. Next up, then, we have Tim McCormick, who is the chief of the Harm Reduction Services branch at the Hawaii Department of Health, and has really been spearheading the Department of Health's response in collaboration with his peers at the Department of Health on monkeypox. He has over 25 years of experience in working at the Department of Health Harm Reduction Services branch, and we'll be sharing with you what the Department of Health is doing and will continue to do to make sure that our community is safe, has access to accurate information and vaccines. Next up, we will have Thaddeus Pham, who is the Viral Hepatitis Prevention Coordinator at the Hawaii Department of Health. He also has many other hats, as many of you may know. He is the co-director and founder of Hep Free Hawaii, actually with myself, which is a coalition of over 100 partners dedicated to eliminating hepatitis. And he's also the chair of the Sexual Gender Minority Work Group within the Department of Health. He's also currently a Bloomberg Fellows at Johns Hopkins School of Public Health. And then we have Walter Enriquez, who is the founder and CEO of Gay Island Guide, which is now in its 6th year, and is the go-to resource for the LGBTQ plus community, not just around events and things to do, but how to find information like monkeypox that may save lives. As born and raised in Hawaii, Walter is much more than a businessman, but a partner in public health. And he has been very active in ensuring that the LGBT community have what they need around COVID and now around monkeypox. So we're very excited to have these 4 amazing presenters this evening. And then, as I mentioned, we'll have lots of time for talk story and hopefully some questions and answers. So please do put any questions that you have in the chat. I will be managing those. We will take some questions as we go along and may leave others at the end. but it's my honor to introduce Dr. Christina Wang, the medical director of the Hawaii Health and Harm Reduction Center, to get us going on an overview of monkeypox. Thank you, Dr. Wang.
Thank you so much, Heather. And Heather Lusk is our wonderful executive director here at H3RC. So we really appreciate everybody's time tonight and coming together to discuss this. Please feel free, I think, as Heather mentioned, to go ahead and put comments in the chat so that we can address them as needed. Next slide, please. So what is monkeypox, right? So it's a rare disease caused by infection with the monkeypox virus. You may see it abbreviated as MPX. It's a zoonotic disease. It's part of the same family of viruses as what's called the variola virus, which is the virus that causes smallpox. But interestingly enough, not related to chickenpox. So we hear that question quite a bit. It's rarely fatal, but we will get touch on folks that might be more at risk for more severe disease. And this is just a picture of what that virus looks like. Next slide, please. So where did it come from? What's the history of this? What do we know? And it was discovered in 1958 when 2 outbreaks of pox-like disease occurred in colonies of monkeys kept for research. Despite being named monkeypox, and this kind of has been controversial, the source of the disease remains unknown. We know African rodents and non-human primates might harbor the virus. If you're interested, there's a wonderful MMWR report that just came out on August 5 that talks about the last outbreak in the United States being in 2003, and that was actually related to prairie dogs that had been housed or transported with African rodents. The first human case of monkeypox was recorded in 1970, so it has been some time. So there is known research about this disease state. And prior to the 2002 outbreak, pretty much reported in Central and Western African countries. And then previously, almost all monkeypox cases were outside of the United States, and it was brought in to our country or other countries through travel. Next slide, please. So monkeypox and HIV. If you're living with HIV and you are concerned about monkeypox, we are here to say that there is no significant research saying that folks are at increased significant risk. However, that is because we're focused mostly on the research for folks that are living with HIV that have a well-controlled viral load and high CD4 counts. And this study here that I've highlighted looks at May to July, and there was a total of 2,891 US monkeypox cases. And among 334 persons with data available on their HIV status, 41% had HIV. Again, I'd ask, if you're very curious about the statistics and the data, the MMWR, which is a report put out by the Centers for Disease Control and Prevention, does give some more specific information about folks living with HIV. But I just want to reaffirm that, even for individuals that are not engaged in their care for HIV, they're definitely eligible for vaccination and definitely should be in touch with the Department of Health or other vaccine clinics if that's right for you. Next slide, please. So what are the signs and symptoms? A lot of it is the general type things that we describe when we talk about viral illness, and that's fevers, headaches, muscle aches, swollen lymph nodes, or known as lymphadenopathy. You might have chills or feel really fatigued or exhausted. There might be respiratory symptoms like sore throat, nasal congestions, or cough. But rash is the one that most people think of because it's so profound and kind of classic of this virus. And the rash can be located on or near genitals or other areas of the hands, feet, and mouth. But you don't necessarily have to experience all of these symptoms or even in a certain order. And that is why we're talking about all the signs and symptoms. The disease is actually defined in 3 stages. So they call it the incubation period, which is approximately 1 to 2 weeks. And then it's basically, that's the prodrome phase. And then it's characterized by fever and those lymphadenopathy that we just talked about, those swollen lymph nodes, oftentimes in the neck, under the armpits, or in the groin. And then it's followed by the onset of these deep-seated vesicular or pustular rashes that are going to form. So just want to call your attention to that the virus actually is around for up to 4 weeks, because it actually might take that time for those lesions to crust over. So the next slide, please, will show what the rash looks like and kind of the phases that it goes through, and including those scabs and before it's completely healed is a time period that we still say that somebody could be infectious or transmitting the virus. So the rash can look like pimples, blisters. Some are reported to be painful or itchy. In more severe cases of monkeypox that required hospitalization, people did describe having such sores in their throat or their mouth, or having those lymph nodes be so swollen that it was difficult for swallowing. Or if you had a lot of sores in the genital or rectal area, then it could be difficult voiding, meaning urinating, or having a bowel movement. Next slide, please. Not going to go too much into this. This is the evolution of what cutaneous lesions look like and kind of the phase, both on the skin as well as inside the mouth. But I just really want to call attention here that the illness typically does last 2 to 4 weeks. Next slide, please. So how does it spread, so that we're really aware about how best to prevent illness, right? So monkeypox can spread through close personal contact. It's often skin to skin, direct contact, right? And that's why we think about spending prolonged periods of time with persons, either making out, hugging, kissing, having sex, but it can also be touching objects like clothing, bedding, or towels that may have had droplets actually on those surfaces. Contact with respiratory secretions, and then prolonged, face-to-face contact, or even sex toys. Next slide, please. So there's a resource online, if you're curious, on the CDC webpage about how to disinfect and how to isolate. And although this page can seem a little daunting, I've tried just to pick out the resources here that might interest you in terms of home disinfection and prevention. And it just talks about hygiene and cleaning and making decisions around isolating during the time of your infectious period, which I mentioned is up to 4 weeks. Next slide, please. So there it is. I'm just calling attention again. It can spread from the time symptoms start until the rash is completely healed and all scabs have fallen off and that fresh layer of skin has formed. And so it does take time, obviously, for some of the rashes to heal and those lesions to heal over. But, that's all part of the natural progression of the virus. Next slide, please. So really, I think the key here is that we're really educated about the virus, that we understand how it's transmitted and how to prevent, right? Prevention is really our best friend. So we're going to make what we like to call over here at HCRC harm reduction risk, looking at the risk benefits. So we might want to consider avoid close skin to skin contact with someone that has an active rash, or it definitely has been reported to have been exposed to monkeypox. We don't really want to touch the rash or the scabs of the person that's currently infected. Do not kiss, hug, cuddle, or have sex with someone with monkeypox. Of course, these are the CDC recommendations. I do understand that in real world, we have to think about what's feasible to live with. And certainly if you're living in a household with someone who is living with monkeypox, we would want to take precautions just like we did with COVID. Avoid contact with objects and materials that person with monkeypox has used. So that's things like sharing utensils or sharing towels. We want to wash our hands often. Gosh, how many times have we heard that throughout the last couple of years now? We really want to make sure that we're effectively washing our hands. You can always sing yourself the birthday song to know how long you've washed your hands for the right length of time. We want to make sure we're using soap and water or alcohol-based hand sanitizers before we're eating, touching our face. We want to exchange maybe contact information with new sexual partners for follow-up if needed, or discuss that. And, I just really like to piggyback, and the MMWR, again, I can't say enough, this was a really good one in August, talked about, if we're even thinking about someone having monkeypox, now's the time to just get engaged in healthcare and maybe also screen for all STIs. And in some cases, symptoms might be mild for folks, so they might not even know they have monkeypox. So it's really important that we're diligent and we're thinking about ways that we can protect ourselves. Oh, next slide, please.
Actually, Dr. Wang, before
Yeah,
we move on, we had a
yes.
question from James. And his question was about his Dignity Honolulu group that has a service every Sunday and wanted to know about how monkeypox might affect people in the service. So could you just talk a little bit about group settings and what people can do to prevent a spread of monkeypox?
Yeah, absolutely. So in that setting, I would be less concerned about the risk. Additionally, I'd like to call your attention to the CDC website. They have a group settings document. And what I mean by that is it's actually like a strategic plan. If you're planning to have a group of people together, it talks about ways that you can think about keeping everyone safe and healthy. And some of those look very similar to what we've been talking about during COVID, which is the hand washing, some social distancing, considering the mask, although I know that's getting more controversial every day. But I would not be concerned with the Dignity Honolulu group. Is there something specific that I can address with the concern there?
I don't know, James, if you had any follow-up. Okay, well, we can move on, Dr. Wang. I know we're going to talk later
Yeah.
about prevention messaging and how, as you mentioned, how to be more realistic about what people can do and still, maybe be sexually active. And we'll talk about that
Yes.
a bit later. But thank you. I think the last question was that could you get monkeypox more than once?
Oh, great question. So I have not seen in the literature people with numerous diagnoses, but I am sure that it is feasible, particularly amongst persons that may not have a robust immune system. I would be more concerned, but it's a great question. I'll have to look up the length of time or if any documented cases or if Department of Health on the line is able to answer that more specifically.
This is Tim McCormick from the Department of Health. I can provide a little bit of information because we were just looking into this very question about whether, how long immunity from infection lasts. CDC did have information about a single case of an individual getting monkeypox a second time, but they suspect that is a very rare occurrence. One of the issues is that since most of the cases up to very recently have been in Central and West Africa. And right now, the cases that are in other countries, there's just less experience with kind of how things are progressing over time. So, there's a lot that we don't know, but CDC's information right now is that reinfection, though possible, seems to be relatively low likelihood.
Thank you so much, Jim. I really appreciate that. So what do we know about treatments right now? We know that there are antivirals available, such as TPOXX. I will mention that they are investigational drugs and that CDC is using them through what's called compassionate use. So that's more likely to be used in a hospitalized setting for more severe illness. And there's no treatments that are specifically designed for monkeypox. As I mentioned, we're using other antivirals that have been used for similar pox-like viruses. And the preferred method, of course, is going to be vaccine to protect against monkeypox. And I think later on, both Tim or Thaddeus or I can recircle on how we talk about the terms PrEP and PEP, meaning pre-exposure and post-exposure, and how we're using vaccine strategy for this. And these are the clinics that H3RC is currently holding, and we're looking to hold more. We're very excited and so appreciative to the Department of Health for the partnership. We held our first clinic today for vaccination. We'll have another one tomorrow and through next week as well. These have been slots that were for existing clientele inside of H3RC that met the defined categories for vaccination as determined by the CDC and the Department of Health. And we actually are already getting our wait list. So we're very excited to be a part of this initiative and looking forward to acquiring more vaccines to offer more vaccinations to folks. And those are my citations. I didn't explicitly list the MMWR on this, but I'm happy to put the link in the chat. I do have it printed out in front of me. And I see that my dear friend, Dr. Alan Katz is on, and he taught me to walk around with these MMWRs when he was teaching. And he's right, they're just the best resource guide. So if anybody has questions, I would love to address those, or go ahead and turn it over to our wonderful next speaker, Tim.
Yeah, Dr. Wang, I don't see any other questions for you right now. But again, folks, feel free to put in the chat and we'll turn it over to Tim McCormick with the Department of Health. And Tim, there were a couple of questions in there about DOH and vaccines. So between you and Thaddeus, I think you already saw them. Thank you.
Great, thank you. Good evening, everybody. As Heather said, I am Tim McCormick. I'm the chief of the Harm Reduction Services branch, which has responsibility for HIV, sexually transmitted infections, and adult viral hepatitis. And then we collaborate with other parts of the department on sexual and gender minority health, preventing opioid overdose deaths among people who inject drugs, and most recently on the monkeypox virus outbreak. So this evening, I'm going to talk about the Department of Health's response to monkeypox and about vaccine access. So Heather, if you can go to the next slide, please. Thanks. I wanted to show this slide. I'm not necessarily going to go over all of this. Sorry, I'm getting your message here. But I wanted to share kind of what the really public messaging, what the type of public messaging that we're sharing, things about anyone can get monkeypox, that it's how it's transmitted, and that vaccine is recommended for communities that have been disproportionately impacted. Next slide. The department is also being very intentional in always using anti-stigma language and really trying to include this in whenever we're talking about monkeypox. Points like infections don't discriminate. This isn't about somebody's sexual orientation, and that anybody who is exposed to it can get monkeypox. It's not about who they are. It's about that exposure. So while the anti-stigma messaging is really important, it's also very critical for the department to be sure that clear messaging is getting to the people most impacted, and that they're hearing it, and that they're understanding that the message is for them. So one of the key public messages is that the risk for most people in Hawaii is very, very low. So I'm going to address, I'm going to, in this forum, I'm going to assume that most people here are gay, bisexual men, other men who have sex with men, transgender individuals, and are allies. So my comments in this forum are more intended for those who are at risk of getting monkeypox or their friends and allies, and not so much for the general public. So as Dr. Wang indicated, monkeypox is established or endemic in parts of Central and West Africa. You can go to the next slide. So, thanks, Heather. And in the current outbreak began in May of 2022 with a case in the United Kingdom. It happened to be the very first ever case of monkeypox in the United Kingdom. And then during this outbreak, the first US case was reported on May 19th, and then the first Hawaii case was reported on June 1st. And in Hawaii, we began vaccinating close contacts, and those were primarily sexual partners of the cases on June 19th. The current outbreak is approximately 30,000 cases in 81 countries that have not historically reported monkeypox. And of those, approximately 9,000 cases are in the US. To date, there have been 13 cases diagnosed in the state of Hawaii, 10 on Oahu, 1 on Hawaii Island, 1 on Kauai, and 1 on Maui. 12 cases were reported among Hawaii residents, 1 non-resident, and 3 resident cases had exposure related to travel outside of the state, but not all cases have been linked to either travel or contact with another known case, suggesting that local transmission is occurring. Most of the cases, both nationally and in Hawaii, have been among gay and bisexual men and other men who have sex with men. Next slide, please. So I wanted to talk about the Department of Health's role. One of the important things that we do is identify and notify individuals of possible exposure. This is referred to as contact tracing. Many of you heard it in the context of COVID. I want to just make sure that people understand that all of the information about the initial person we refer to as a case and the context, all that information is kept confidential, and we never disclose the identity of the initial person to any of the contexts when we're trying to do follow-up. The contact tracing is done with each new infection that is reported. This allows us to screen those contacts for symptoms, to let them know what symptoms to watch out for, to offer vaccination for those with moderate or high risk exposure. This is, as Dr. Wang referred to, post-exposure prophylaxis. It's vaccinating people early enough after exposure to prevent infection. And sometimes if it's not quite early enough, it can, if it doesn't prevent infection, it can reduce the severity of illness. So contact tracing also allows us to link individuals to medical care for diagnosis and treatment if needed, and then to help them take steps to prevent further infection. So contact tracing and post-exposure prophylaxis can be really important tools in slowing down the spread of an infection like this. And this is really a matter of the Department of Health being able to partner with the individual who has monkeypox and together helping to contain the infection. So Jynneos, which is the name of the main vaccine that's effective against monkeypox, and TPOXX, which is the name of the main antiviral treatment for monkeypox, are not commercially available. Both of these are in the National Strategic Drug Stockpile, and one of the Department of Health's role is to coordinate ordering these from the U.S. Centers for Disease Control and Prevention and distributing them as needed within the state. We also coordinate with medical providers on diagnosis, testing, vaccination, and treatment. And then we set allocation and prioritize resources. And an example of this is there is not enough Jynneos vaccine for everyone, and we need to decide how to use that to have the greatest possible impact on the outbreak. And everyone is protected when we do that really well. So far, just 2,900 doses have been allocated to Hawaii. There will be more that are available by the end of the month, and we soon may have a way to vaccinate a lot more people with the supply that we have. Even so, it will continue to be important that we get vaccine to those who are most at risk of being exposed to monkeypox. Some of the other DOH roles are providing public health guidance, like infection control guidelines, and disseminating information to the public. Next slide, please. I want to talk a bit about vaccine access options. So the Department of Health is operating a number of pop-up clinics around the state. In addition to that, we're also partnering with sites in the community to be vaccination sites. So one of these is Hawaii Health and Harm Reduction Center. We're also partnering with the HIV case management agencies in each county. Many people who are at risk for monkeypox already know these agencies, and many have access services there, whether it's for HIV care, HIV pre-exposure prophylaxis, or other HIV prevention services. And then we're also partnering with medical providers that see patients for HIV or for HIV pre-exposure prophylaxis or for sexually transmitted infections. And then we're partnering with community health centers as well. So I'm going to focus mainly right now on the Oahu clinics. I'll mention neighbor islands because I see there are some neighbor island folks on the line. But at the top of this slide are a list of the Department of Health pop-up clinics. You'll see that the clinic tomorrow and Saturday are both full, as well as the clinic next Tuesday. But this Sunday and the following Saturday, we've moved the clinic to a much larger location in town, and we have a large number of slots available. So there is opportunity to be vaccinated as soon as this Sunday. Hawaii Health and Harm Reduction Center, Dr. Wang already mentioned that the vaccinations that they're doing. I also wanted to mention our other Oahu partners, Waianae Coast Comprehensive Health Center out on the west side, Kaiser Permanente, and Waikiki Health. So those are, Waikiki Health is not on board yet, but they're working on, and they should be a vaccination site soon. So altogether, for this week or over the next 7 days, there are a total of 800 vaccination slots on Oahu. So, if you think of the 800 vaccination slots and our total allocation to date is 2,900, there are a lot of opportunities in the next 7 days on Oahu to get vaccinated. There are also opportunities on neighbor islands, and the way that somebody accesses the service for the neighbor islands, they can either call this line, the monkeypox vaccination information line, or they can go to this online scheduler where they can request an appointment. So Neighbor Island folks, when they request an appointment, either somebody from the district health office on their island or from one of our partner agencies on their island will contact them when they have appointments available. So this same tool is also acting as an online scheduler for the next 2 large Oahu events and that the Department of Health is doing, where there are a number of slots. So right now on this online scheduler, you can book an appointment for this Sunday or next Saturday. And then again, the call-in line, if this, you can also book appointments through the call-in line. So one of the things we really want to emphasize that we think is important is really giving people options and really having a multi-pronged approach. We know that not everybody is going to be comfortable going to a Department of Health clinic. Not everybody is going to be comfortable going to Hawaii Health and Harm Reduction Center. The important thing is we give people options so that people can find something that is comfortable for them. So we'll continue to look for a lot of really diverse options in a variety of different settings where people can be really comfortable. To address kind of some of the questions that came up, I think there was a question about the second dose. And so Jynneos is a 2-dose vaccination. We are right now, because of the very limited supply, we are using a first dose strategy. So we're not scheduling second doses for most people. And that's in an attempt to get as many people as possible some level of protection to really slow down the spread of this disease. One exception to this first dose strategy is that for individuals who are immune compromised, they are recommended to go ahead and get their second dose, and we will schedule second doses for those individuals. So as Dr. Wang said, that doesn't mean people with HIV in general. So if somebody's living with HIV, the individuals that would be considered immune compromised and really recommended for a second dose would be people with really advanced HIV or HIV that's not controlled, not virally suppressed. Other immune conditions would also qualify somebody, make them recommended for a second dose. So undergoing cancer treatment or taking immunosuppressive drugs for any number of reasons. So I want to stop there. I definitely want to leave as much time as possible for questions and discussion. So at this point, I'll hand it over to Thaddeus to talk about vaccine eligibility. Thanks.
Great, thanks, Tim, and thanks everyone for your engagement in the chat. I just want to reiterate what Tim said earlier and just have everyone just really know that this is something that the Department of Health takes very, very seriously. You can already see all the response that's happening that Tim shared, but also that we continue to do so and continue to reach out in venues like this and other ways to get your feedback and hear your responses and to respond in a timely and really meaningful way. So with that in mind, I'm going to share with you the current eligibility for Jynneos because it does apply and it does actually reflect some of the feedback that you folks have provided. So currently you could see there at the very top, I just want to reiterate, it's also in the chat, the phone number and the link that you can use to register if you're eligible for the Jynneos vaccine at one of those clinics that Tim had mentioned, in addition to the ones that are being provided by our partner sites. For post-exposure prophylaxis or PEP, this is specifically in regards to monkeypox. I know we might hear PEP or PrEP in other contexts, but right now we're speaking specifically for monkeypox. These are for folks who've been in contact in the last 20 days with someone with a known monkeypox infection. We are also providing vaccines for expanded post-exposure prophylaxis. You can see here it's called PEP++. And you can see the definition here is, and I'll just read it to you now, gay, bisexual, and other men who have had sex with men and transgender individuals with high-risk intimate contact in the last 14 days. I will also acknowledge that thanks to all of you in the community, you folks have reached out and shared with us your reactions and your feedback on these eligibility in terms of how it's worded. And please rest assured that we are currently also updating this to be more inclusive and appropriate and to reduce any chance of stigma. So really, I want to reassure you folks that we continue to listen and respond. We were literally talking about this like a few hours before this discussion. So please continue to share your feedback. And thank you all. I see many of you on the line who've texted me, DM'd me, messaged me, and emailed me, and please continue to do so. Next slide, please. And also note that this eligibility is on the website as well, so you will see it there. I want to just kind of transition to Walter, but before I do, I just want to again mahalo everyone for your feedback. And part of the response that we've been able to put together is, if you want to scan this, I'll also put a link in the chat to have, we've created localized community communication toolkit, because we know that sometimes the responses and the messaging that we might hear from other spaces or on the continent are not necessarily reflective of our local communities. And so we created materials that are more appropriate for Hawaii and for our particular folks that we work alongside with and among. So I want you to just know that this opportunity is there. So if you want to scan this QR code later, I believe the slides will be sent out and made available, but I'll also put a link in the chat. Before I turn it over to Walter, I also want to note that, again, if you folks have comments or if you folks have feedback and you're not able to get that addressed today, please reach out to us. I will actually just put my email in the chat. Every single comment that folks have made, at least that I hear about, I do make sure that I address, even if we can't address it right away. So please know that your voices are important to us and that we want to hear from you and that we will try to respond, even if we can't address it right away. So I think really the big mahalo is to everyone attending today for really engaging in this. And Christina, I saw your hand raised. I don't know if you wanted to respond to that.
No, I just wanted to thank you so much. And I also wanted to put in a plug that if anybody is not, loving vaccines, because they might not really like the needle, I just want to say they're very small, and we had such a good experience with our patients today. That some people were really scared, and then they got their vaccine and they realized it was okay. Today we did the subcutaneous injection method, which is in the back of the arm, so it's kind of in that fatty tissue. And just did want to just address that if there's fear of side effects from the vaccines, it's just mostly people complained of tenderness at the site of the injection, which is relatively to be expected. And then some of the other concerns, if you read kind of the larger global package insert about the vaccine, is just some headaches or some fatigues, or just feeling a little more, run down after the vaccine, but that people's energy level and things resumed. So hopefully that might quell any fears about vaccination.
And Thaddeus and Tim, I just want to say on behalf of H3RC and the community, how grateful we are to have such collaborative relationships with the Hawaii Department of Health. Folks know right from the moment there was the first case, we heard the health department reaching out and educating and linking us and making sure that we had information. In fact, there's now a weekly call with the Department of Health with all the community partners. And I think I can say that not everybody in other states is blessed to have such a close collaborative relationship. And please, our experience, I've worked with Tim for 20 years, for Thaddeus, gosh, almost that much too, Thaddeus. And they really mean it. Look, they're both putting their email and their phone in the chat. So please take them up on this and share that information, because they do share it with their leadership as well, and that your voice really does matter. So thank you, Tim and Thaddeus and everybody at the Department of Health. I see several others, I think, on the line as well, for always being so collaborative with the community and hearing us. One other question before we go to Walter was, do you expect Hawaii to get another shipment of doses? And any thoughts about that? Thank you.
I can answer that. Yeah, so we are kind of in line to get more doses before the end of the month, I think as soon as August 15th. And there's also, as I mentioned, there's there's a strategy coming online that would really allow us to significantly stretch our existing vaccine supply and vaccinate a lot more people. It has to do with the method of vaccination. So that's kind of a current topic, and it's very possible that the really constrained supply will become less of an issue very soon. Thanks.
Thank you. And then Dr. Wang, there's a question from Maureen. If a healthcare worker gets monkeypox, is there a quarantine period?
I think everybody is subject to the same requirements that the Department of Health guidelines has put out.
Which is, so the answer is yes, that they
Yes.
should quarantine. Okay, thank you. So we are going to transition to talking to Walter now. And I just want to thank you so much, Walter, for being such a partner in public health and the work that you're doing. So turn over to you. And actually, can I ask you the first question that I have for you, which is what are you
Sure.
hearing from other LGBT owners or owned businesses about monkeypox and the messaging about monkeypox in our community?
So basically, I think everyone, and I've been to a lot of the news stories too, the mainstream media. I think at this point, many people, not only businesses, but many just community members, everyone's kind of fatigued already because of COVID. So they're fatigued from pandemics. So hearing monkeypox, and obviously, on a national level, and the extremism that's kind of surrounding it, it's just making people a little bit more afraid. And then, of course, it didn't help with the initial stigma that came out. And even in Hawaii, when the first cases started to come out and our mainstream local stations, how they were starting to present the news, kind of stigmatized the disease. They really highlighted the gay and bisexual men and men for men and etc. But, thanks to Katie, and as you all have mentioned, our partners at the Department of Health, instantly I was basically connected with Katie, and she's been very responsive and I think she's on here. I think I've seen her on here earlier. Very responsive, and even Tim and Thaddeus, we're talking almost every day now. And so initially, we discussed it with Katie, and so the Department of Health was quick to change their press releases to basically highlight the fact that anyone can catch monkeypox, and it's not just a gay disease. Really, anyone, as all the information that was shared earlier, it was, it's skin to skin contact. So literally, any human being can catch it. If you've got skin, you can catch it. That's the bottom line. And I know I've seen someone ask earlier, how can you address that when talking to other people? You can literally say, if you're a human being and you got skin, if you look at all of the science and all of the medical information being shared, it's literally skin to skin contact. It's intimacy for the most part that you can catch it. And then of course, you can catch it at home, sharing the same bed or sharing a bath towel with a relative. So, anyone can catch the disease. And so, the businesses, they're afraid of the stigma. We've been talking about hosting clinics there as well with the DOH. But in the end, the great part of our LGBT businesses is that in the end, they're still going to do it. We've lived through HIV and the stigma with that. And, the LGBT community, they always come together.
Oh, thank you so much, Walter. I think all of us bristled with some of the early media because this is not a gay disease. And especially those of us old enough to remember the early days of HIV, it was very scary. So how can we target our messaging, given that unfortunately our community has been disproportionately impacted, but how do we target our messaging and not perpetuate stigma?
I think at this point, I think on the national level already, and I think it's quite out there that I think the community, though we have a decent sized LGBTQ plus community here in Hawaii, I think by now, most of the people understand that it is this particular disease is disproportionately affecting men who have sex with men. So really, I think on our local level, we can actually start getting away from that. I don't think we even need to really mention that because I think the message is out there. At least on the state level. So like information coming from the Department of Health or other organizations that work with the broader community. And that I think will kind of help to start changing the dialogue. And then to really target, the higher risk communities, which is a part of at this current outbreak, it is, gay, bisexual men and those men sleeping with men. We can utilize resources and organizations that actually work and are in constant touch with the LGBTQ plus community. And that's where, for instance, like Gay Island Guide, and that's why I take it so seriously, because I feel the people and that would visit Gay Island Guide, or, if they're following Gay Island Guide on, say, social media, chances are the extreme people that are trying to stigmatize and turn this into the dialogue of that it's a gay disease, chances are they're not a part of that following. And so that's where I feel we can really just target and hone in onto the LGBTQ community. And we have the Legacy Foundation, and I think Nathan's on here as well, and they've been helping to kind of disseminate information as well. But and we have organizations statewide that work on a daily basis or ongoing basis with the LGBTQ plus community. So I really think that's how we can distribute that information.
Thank you. So you already mentioned some of this, Walter, but what are some of the things that you've seen in the response that have been helpful? And what are you hoping for from community partners and the Department of Health moving forward?
So I think the greatest part is that we do have a wonderful Department of Health. And I think the ironic part is that there's a stigma on our Department of Health because of COVID, right? COVID caught everyone off guard. And there's a stigma on the Department of Health because of the response, the reaction, and then, of course, the governor shut down the state and it was prolonged. And so I think there's that stigma on them. But, working with them on monkeypox, the individuals involved are just truly amazing and truly their heart's in the right place. And they've been very super reactive. I think the greatest thing was getting vaccinations out. That was a greater concern of the community, which now we've basically put that out rather quickly. And we're all working together to, disseminate the information, get people booked on appointments. And then, coming up, even for instance, last week, Tim connected me with the Waianae Coast Comprehensive Health Center. And so next week, Sunday, during Gay Island Guide's pool party out in Kapolei at the Residence Inn, we're going to be offering the vaccinations there in Kapolei for, the residents of the West Side or the LGBT community that attend the event. So, it's really just creating spaces that people feel safe and welcomed, not intimidated to come and get their vaccinations. And in the end, it'll protect all of our islands and our broader community.
That's exciting. You're such a great model, again, for partnerships with partnering with whether it's Waianae Coast Comprehensive or others to bring health services to some of the events that you're doing. Walter, this is my last question, and then we'll kind of open it up for more discussion. But what else do you think the community needs to hear about the vaccine and to really encourage people to consider getting vaccinated, especially if they are in those first couple of tiers?
Sure. One of the things, and this is one of the points that I brought up to the Department of Health a couple of weeks ago, is how I've been painting the picture, especially here on Oahu, as well as our friends in Kona, is we have Pride events coming up. And Pride, as we all know, it gathers sometimes in the thousands of people. In fact, I believe in 2019, we had over 8,000 people that attended Honolulu Pride. And so, other events besides the festivals and the parades take place kind of happen. And then this year, we also have the National Gay Bowl that's coming to town, which is going to add another several thousand people to our community. So right now is the best time to get the vaccination, because from what I understand, and our health officials here can correct me if I'm wrong, but from what I understand is for the vaccine to work or its highest or most effectiveness, it takes place 2 weeks after you get the dose. And thus, it's a perfect time to get the dose, get it now, so that way you're prepared, so that when you go to these events, LGBT events or other parties, and it's no secret, some of our community members, they host their own little fun parties privately. At least they're prepared and they're, being a little bit more responsible. And that would be my message to them. And as you mentioned, Gay Island Guide will always continue to offer space to our health department and our partners if it means to protect our health and well-being within our community. In fact, monthly basis and an ongoing basis, Hawaii Health and Harm Reduction Center and your team's always at the Galanine events, and we test for HIV and Hep C. And that's resulted in some people getting treatments that they need. And that's what's important. You know, it's making it convenient for the community, because if it's convenient, it will basically increase the chances of them to get the vaccine. And you know, I applaud the Department of Health for doing these large clinics that are coming up this weekend and next weekend. But in the end, you know, it opens up more opportunity. But then, you know, it still requires someone to go and book an appointment and drive to a site to get that vaccine. So, you know, I think as we get more doses in and our resources increase on the state level, hopefully we can start rolling it out into some, you know, targeted events where we can get to more of our community.
Great, thank you. So we have some time for some questions. So I have one question for our panel, but would really appreciate the rest of you either putting your hand up if you just want to come off mute and ask, or go into the chat. So recently the CDC released their prevention guidelines for people that might be at risk or coming in contact. And one of them was to have sex with your clothes on. And I just giggle a little bit at that because I think that may be a real option for some, but it may not be for others. So what are some safer sex? What is the option for somebody that still wants to be sexually active in this age of monkeypox? What are the suggestions from any of you about ways to, as we would say in harm reduction, reduce the risk if they still want to be active? So we'll open that up to anybody on the panel that wants to share.
This is Tim. I think, you know, I think one of the things in Dr. Wang's slide was really great, and that's, you know, consider getting contact information from partners, because, you know, if you do end up getting monkeypox or they end up getting monkeypox, the ability for the Department of Health to reach out and contact that person and say, hey, you know, you may have been exposed. We can give you a vaccination. We can link you to testing or treatment as needed. You know, that's much easier if there's a way to get a hold of the person. You know, other kind of, you know, real harm reduction messages. I think, you know, the message about avoiding anonymous sex, you know, that is not a great recommendation in general. I think, you know, the recommendation is you may decide to do that. And, you know, if you decide to do that, that's great. But if that doesn't work for you, you know, what are the other things that you can do? Reducing the skin to skin contact, talking about any symptoms with partners, partly, you know, to find out if they have symptoms, but also really protecting our community by increasing awareness among, you know, the people that you have contact with of what the symptoms are, what's going on, so that, you know, more people are aware of it and just keeping an eye out for it. So I think those are kind of some of the more harm reduction approaches that I'd like to emphasize.
Okay, we'll just wait to see if any of the rest of you wanted to pop in. We have a couple questions in the chat. Is it possible for there to be pet to human, human to pet transmission?
I can take that. There is. So, you know, as Dr. Wang indicated, you know, a previous outbreak in the U.S. was related to transmission from prairie dogs, pet prairie dogs, to humans. There is animal to human transmission. Pets can get it. So if you're needing to quarantine or isolate, the recommendation is that you're also avoiding contact with your household pets, because they could get monkeypox and spread it to somebody else. Dr. Wang, I don't know if you wanted to add anything.
Yeah, no, that's correct. Actually, CDC did call out household dogs in particular, but I don't think they meant necessarily just dogs. They just mean pets at the home. There is some risk back and forth, as you mentioned. Yes.
Another question we have from James is, how many days might go by before any symptoms would show up? I read that symptoms might not show up for days. And then the follow-up was, can a person detect any symptoms from the first 1 to 4 days of who they might think were exposed? So Dr. Wayne, could I give it over to you?
Likely not. They actually define the incubation period as between 1 to 2 weeks. So that's really the time frame for incubation. And that's when we talk about those prodrome symptoms, which are things like the fevers or having swollen lymph nodes. And then that's going to be followed by more some of the things that we think about as classic monkeypox, right? Which is the rash.
Follow-up to that is, have there been any asymptomatic cases? Just wondering, does the person from David have to have open lesions or broken skin in order to spread monkeypox? Can you spread it even if you don't have any lesions?
Yes, the answer to that is yes. There are very mild cases where people do not have symptoms, but recall that respiratory droplets can also transmit the virus.
Actually, if I can jump in here, maybe it's Dr. Wang, Heather, that can answer this, because this is the question I've been starting to get on Gallon Guide, is can people catch monkeypox, say they're at a nightclub dancing in a crowded dance floor and sweat droplets are flying?
Yes, the answer to that would also be the more densely packed the scene and the situation, and the more there are human fluids being exchanged, whether intentionally or not, there is a increased risk for transmission.
And follow-up is gym equipment, spas, etc.
Yes.
So again, Dr. Wing, it sounds like the some of the cleaning protocols that we've all been getting used to with COVID, some of those would apply here. And again, I would encourage people to go to the CDC website that Dr. Wang said, but it sounds like that doing thorough cleaning would be one of the prevention methods. Any other thoughts about prevention methods in kind of crowded bodily fluid laden areas?
Not sharing drinks. I know it's really common in clubs, bars, people might share drinks or share food, especially in Hawaii. We always want to feed each other or, share things like that. I would maybe caution against that, and washing hands and some of those same good old COVID protocols. Yes.
All right.
Anybody else? Tim and someone else has their hand raised. I'm looking.
Oh, I apologize. Yeah, Joe. Well, Joe, and then Tim. Unless Tim, you want to respond to that question?
Yes. My question is, last Tuesday I had my shot, and I was told that I'd be getting a call to come in to get my second one. But now I hear, I think it was yesterday's news, that what we have left, I guess, is going to be for that one shot that I had is going to be stretched now to 5 different people. So how much longer will I have to wait? Is that true?
Yeah, so great question. So if your second shot wasn't scheduled at the time of your first shot, then they probably won't be scheduling your second shot until the vaccine supply is large enough that allows us to do that. So we will be calling people back for a second shot, not after 28 days as this kind of the ideal recommendation, but when there's enough supply and we can use, get enough of those first doses. What you're referring to around stretching doses is related to the vaccine, a difference in the way the vaccine is administered. So it'd be intradermally or between kind of the top 2 layers of skin rather than under the skin, requires a much smaller dose. And so the same quantity of vaccine could be used for as many as 5 people. So if and when we make a change to doing that, then our existing supply can stretch much longer, and it would be that much sooner that we would be in a position of being able to give second doses.
Okay, thank you.
And then, the question related to gyms and other settings like that, there's, I think, kind of from the harm reduction perspective, you certainly want to kind of think about what's possible, all of the different ways that it can be spread. But in a harm reduction perspective, you don't want your life to be ruled by fear and to avoid every possible place where there's another human being, right? And so really focusing on the most common routes of transmission. Monkeypox is primarily spread through skin-to-skin contact with the lesions. So the respiratory droplets, the contact with sheets and towels and other things is not nearly as effective a route of transmission as that skin to skin. So if you're looking for a harm reduction way of reducing your risk, if you cut out those really high risk ways and maybe don't worry about the much lower risk type of transmission, then you probably are kind of that's maybe a good way to handle it.
Tim, I have another question. I think that will be good for you. It says the 2003 outbreak was much smaller. Is there a possibility that this 2022 outbreak could be contained in Hawaii? Or are we already over that tipping point?
Oh, that's a great question. It's really, my crystal ball is not working. We only have 13 cases, but as I said, since we can't link all those cases to travel or other cases, that's an indication that there is other community spread that's happening. So, we also have so much travel between Hawaii and other places. And given, how this outbreak is happening in many other places, without kind of shutting down travel, it would be really difficult to contain it based on having identified, the cases that we've identified so far. So I think that seems, probably unlikely that we're at the point of being able to contain it already. But with vaccination and contact tracing, we can do a really good job of really slowing the infection down.
We also had in the chat and ask about how long the virus can live outside the body, which I think is very relevant. We know HIV, for example, does not survive well outside the body. And it sounds like Dr. Wang had one study up to 15 days. But again, the reminder—
that was left undisturbed. So those are in like clinical settings where they monitored that no cleaning solution came by, nothing. It was completely left. So there is still a debate about the duration of surface and the worries about touching surfaces. Again, I think Tim nicely said, like, let's not shut down again and live by fear because we're worried about, touching the weights at the gym, but
yeah, all of us can remember the very early days of COVID. I don't know about you all, I was wiping everything I got from the grocery store, and I think we've learned. And so I think Tim's kind of what I call a hierarchy of risk, I think is a really important concept. And each individual, knows what level of risk they're willing to do, but that if we can try to get some of the higher risk pieces out, then it really makes it more tenable. Yeah. What are the protocols for children in an impacted household? So I'm assuming that means a positive person in a household. What is the protocols for children?
I don't know if the DOH has developed something. I actually referenced something from the United Kingdom that was put out, but I would be happier to see if we had like a local Hawaii. I'm not sure if Tim or Thaddeus know of that.
I don't know if there's specific guidelines, but any household members need to be, the individual with monkeypox needs to be isolated from all household members and pets. So regardless of the age of those other household members, they do need to be isolated.
And would people be encouraged to be tested if they have exposure, or only symptoms from a household member like that, Tim?
So in that situation, if there was a particularly kind of where we are now with the number of cases, our Department of Health staff that follow up with cases would be working in this situation and really guiding both the individual, the patient, and their medical provider, in a situation kind of where there's really specific. So I think that, that would really be addressed at that time.
So anybody that's positive can basically count on the Department of Health to provide some guidance for them, because they will be getting contacted by them as they also try to find out who else might contact tracing and everything that you mentioned.
Right, and as we saw with COVID, once you hit a certain number of cases, contact tracing is just not feasible. We're nowhere near that with monkeypox. So, I would say certainly assuming that things don't kind of just go crazy out of control, we will continue to be following up on every individual who's newly diagnosed with monkeypox to help them understand the isolation the methods for isolation and make sure that they, if they need treatment with TPOXX, the antiviral, that they're able to access it. So all of that will really be with guidance from the health department to the patient and their medical provider.
Thank you. Jewel, I see your hand up and I just want, oh, I'm sorry, Thaddeus, did you want to jump in?
Yeah, I just wanted to add to what Tim was saying too, that the folks who are involved in the contact tracing and follow-up that support folks living with or infected with monkeypox, also people who've worked in our community and are very familiar with our community, and even the people that we would mobilize later should we need more support, are also folks that have experience working with our local communities, especially our specific ones that we're a part of. So I just wanted to also throw that out there as a means of reassurance that these people really care and know that whom they work with. So thanks so much.
No, thank you, and have that sensitivity. Yeah, thank you. Hi, Jewel. Do you want to unmute yourself and ask your question?
Yes. I have had many questions about, is it only, because I deal with a lot of persons in the community that are houseless and they don't have, excuse me, access to information like we all do. And one of the major questions is, I'm so sorry, I have a frog at the wrong time. Is it more easily transmitted once somebody has an obvious lesion or when they have like the symptoms of the flu, the beginning part of the infection, like flu symptoms, fever, all of that? Like what they're saying to me out in my immediate community is they think there has to be a mark on the skin, a lesion, to get it. And I'm trying to tell them, if you have symptoms of the flu and you don't think it's COVID, please seek medical care. Does that make sense?
Yes, I would agree with that. We do know that during that incubation period where there is no rash, that you still could be spreading monkeypox. So if you're not well, please do seek a healthcare provider to make sure we're addressing all the needs. Might not be monkeypox, might be another viral illness. We still are dealing with influenza and common colds, and people come in for sore throat and we make sure we swab them for gonorrhea. They might have oropharyngeal gonorrhea. So I think there's a whole host of reasons you'd want to seek a healthcare provider to make sure that your health is being cared for holistically.
Thank you.
If I could add, I think, the other thing to keep in mind, I think a lot of us have seen the photographs from places in Central and West Africa where it's endemic, and you see people with, dozens, hundreds of lesions all over their body. That's often not what it looks like, at least in the current outbreak. In the current outbreak in the US, most people, more than half of people, had fewer than 10 lesions on their body. And so some of these lesions are really, not very remarkable. They're, starts out just kind of looking like a pimple, and there, don't necessarily have to be very many of them. And so, that's just kind of something else to keep in mind, that people aren't expecting to see somebody that's totally covered with these pox all over their body, and then they'd say, oh, okay, that person has monkeypox. It's not necessarily what it's looking like.
We had a couple of questions. Oh, thank you so much, Katie, for just putting the US map. So somebody was asking if there was a map of infections, and it looked like thank you so much, Katie. Katie, by the way, is the one that Walter talked about earlier, I believe, who's been really responsive from the communications office at the Department of Health. So thank you so much for being so responsive. We had another question about, if numbers go up, might there be isolation facilities the same way that Hawaii did that for COVID, if people can't isolate at home?
At 12 cases, I think we're far from that. And again, I think with a really manageable number of cases, the department will be working with every individual to figure out a solution for them to be able to isolate. I would just say we will continue to figure out what needs to be done to make sure that an individual can isolate and not further. Monkeypox won't be further transmitted.
Yeah, and I'll add to that too. We've had discussions with folks from the governor's office on houselessness as well about this. We're really trying to be proactive and preempt anything that comes up. So I believe, Heather, I'm going to actually shout out you real quick. I think Heather's going to be speaking at with our houseless service providers next week, I believe, on some of this guidance from the National Healthcare for the Homeless, which does talk about providing opportunities for folks in non-congregate settings or, in terms of isolation. So we are thinking about these things. I'll also note that, and this has already come up, even though we don't need it currently, we're also looking at, language access and other things. So we're really trying to preempt and think ahead on this. So thanks for bringing that up, Tina. Appreciate that.
Sounds like, Jewel, do you have a follow-up question?
Yes, there's a lot of fear out there right now in the homeless community. And it's really hard for me to give them answers. Hearing from Thaddeus that perhaps there will be a way to isolate outside of their community setting, being houselessness. So thank you for that, Thaddeus. I appreciate that. And it's a big fear of mine because I'm out trying to give people hope and love. And they ask me these questions like, what happens if I get monkeypox? And I'm just saying, hey, it's a virus. Watch yourself if you feel sick, your lymph nodes, yada, yada, the regular protocol. Because I can't refer them to a CDC website, giving them the information that you all and I can get. So all I can do is whip out my phone with all of this wonderful information that I've gained today. Thank you so much.
Thank you, Jewel. And as Thaddeus said, I'm going to be speaking to the Partners in Care on Tuesday. And we've also talked about, I think H3RC is going to be working on a monkeypox flyer. That'll be the same way we did for COVID for the houseless community, because I agree, it's really hard to get information when you don't have, access to some basic resources and needs. So thank you. And thank you for what you do, Jewel.
Heather, can I also just
yeah, please
jump in? Yes, thank you so much, Jewel. I really appreciate that. And as you folks think of these things, please reach out to us. That's why Tim and I put our contact information. If you think of ideas on how better reach folks who are harder to reach, or think of other ways of disseminating information, that would be really wonderful for us to hear, so we can ensure that folks who might not be able to attend Zooms or check websites or things like that still have the option and opportunity to get care and access to vaccines. So thank you so much for that.
I think we have time for a few more, but we're actually going over time, but thank you to our presenters for staying. Thank you. Dr. Wayne, there was a question about showering or bathing, because that might be painful if you have lesions, but does that have any impact on transmission?
Great. So Cleveland Clinic actually has some symptom management guidelines that I've posted in the chat, which talks about, using medications like acetaminophen, ibuprofen to help with the aches, the malaise, some of the generalized pain. They talk about doing an oatmeal bath or having to cover single lesions or localized lesions to kind of help limit the spread. But again, if you do use the bathroom and that others in your household are going to have to use that bathroom, good disinfection protocols would be necessary, because they did actually swab hospital bathrooms of persons that had been in those rooms with monkeypox, and did find on the swabs monkeypox living on door handles, on toilets, in the bathroom. So that would be the area that I'd highly recommend disinfecting and looking at the CDC disinfection guidelines. But yes, bathe, shower, all those things.
And Dr. Wang says, would it also be true that if you had more open lesions on your own, like if I had broken skin or I had another STD that was like a herpes blister, we know that sometimes can, I'm just curious if that could facilitate transmission, or that doesn't really matter when it comes to contact, because sometimes that could be another harm reduction, right? If you have open lesions, you cover those with the skin to skin contact. Have you seen anything about open lesions that might be open, as my colleague said, open sores or open doors? Is that true here?
I'm not sure I quite understand the question. Are you saying if you have any open sores to just cover them?
Yeah, like if somebody who did not have monkeypox had open
right,
sores,
sure.
are they more at risk for coming in skin to skin contact because there's an opening in the
Good
skin?
question.
Oh, sure. I do believe so. Anytime you have cuts or openings in your skin, that is a portal or an entryway for infection, just like we talk about general practices in the healthcare setting with wearing gloves and being aware, right, of just general practices to reduce transmission risk.
Okay, I'd like to just end with just a few words from each of you of like, what do you think your final message, if you were to pick one take home message today for the community, what would it be? And actually I'm going to go in reverse order. So Walter, I'm going to start with you and then we'll go to Thaddeus, Tim, and end with Dr. Wang.
I think my take home message to the community is get vaccinated and, keep being educated on the disease and getting accurate information from trusted resources for sure. That'd be my short and brief take home message.
I guess I go next. We're going backwards. So my message would just be that your voice matters and we want to hear about it. So please, I put my email again, reach out. We want to hear from you so that we can make sure that we protect our communities. And thank you for all you do.
I think my message, particularly to gay, bisexual men, men who have sex with men, and transgender individuals, if you are at risk for monkeypox, get vaccinated. Please don't let stigma prevent you from doing that. Support other people in our community. Even if you're not personally at risk, support other people in our community. And just don't let that stigma and shame take any hold, and really support each other in taking care of our health in our community.
Really hard to follow. Those are excellent recommendations. I would probably echo the same. I hope that we've quelled any fears about getting vaccinated tonight. And so please consider that. And if you have any further questions or concerns, please reach out so we can make sure that those are addressed and you get the health care that everyone deserves and needs.
I want to thank everybody for taking time today. Thank our presenters and our man behind the scenes, Andrew Ogata, who set this up. Thank you, Andrew. And really appreciate all of you taking time after what I'm sure was already a long day. But this just shows you again the commitment that both HBRC, the Department of Health, and Gay Island Guide have for the community. We'll probably be giving you another update sometime soon, or maybe we'll be blessed to stop this outbreak. Either way, thank you for what you do to help save lives, help break the silence, and also to fight stigma. Take care, everybody. Aloha. Thank you again for coming.
Thank you, everyone. Aloha.
Thanks, everyone.
Thank you.
Thank you. Good night, everybody.
Thank you, everyone. Aloha.